Well, that's, I would do everything.
Last year they were taking. Totally fine. They don't come back home. Perfect. Okay, perfect.
That's good.
Wonderful, yeah. Exactly.
Good morning, everybody. Thank you so much for coming. My name is Tanya Espinoza. I'm the Chief Development Officer here at Community Hospital, and we are so thrilled to have you with us today. Just a few housekeeping items before we get going. Hopefully you have found the coffee and water and goodies back here. Please feel free to get up anytime during the meeting and refresh what you need or grab some more. If you need restrooms, they're directly across the hall outside of these doors here. And also we are recording this today, which is why we have the microphone so that our folks online are able to hear us. So if you have a question, please raise your hand and we will make sure to get the microphone to you so that everybody in the room can hear you as well as those online. So with that, I will turn it over to Dr. Corey Klein from Family Health West.
Everybody hear me okay? Great. And I'm a bit of a wanderer, so I have my availability here, so hopefully it'll change the slides. But if the slides or something don't change, we'll have to work on that. But thank you everyone for coming. This is a talk about Medicare. It's part of Family Health West's community outreach program, and this is actually the 4th time I've given this talk. And so every time I get it, I get a little bit faster. But it should last about 40 minutes is what I have to say. And then the rest will be question and answer. So depending on how many questions you all have, will be done in about an hour. So I am a board certified family doctor. I am also the president and CEO of Family Health West, which is a critical access hospital in Fruita. I am not an insurance agent. I am not a Medicare salesman. I am not a broker. I do not represent insurance companies, although my hospital does take most insurance. So if you have questions regarding what should I pick or what should I do, this is really not intended to sell a certain insurance product or to advocate for one way or another. It really truly is intended just for educational purposes. I've gotten good feedback on it so far, which is why I've done it 4 times, because people say you need to keep getting this talk. And so we may even have a broker or 2 in the audience. I had a broker in the audience last time I gave it at the library, the Grand Rapids Public Library. And that's okay too. I try to answer those questions, but they may be more of an expert than me. But hopefully that's not really the intent of the talk. It's not a sales pitch. First, though, I want to thank Community Hospital for giving me the opportunity to give this talk here. Because it's not aimed at my hospital, it's not aimed at selling anything. This is really for the public. I want to thank Chris Thomas, the CEO of Community Hospital, for sharing in the vision of it's really important to educate the public on topics that are important to our hospitals. I want to thank everyone at Community Hospital that helped make this possible, the marketing department, the food service for the goodies, and everyone else that put this on. I always start, and I know I'm at Community Hospital today, but I always start with our mission statement. And I actually like Chick-fil-A's mission statement better. It's a lot simpler. Ours is very complicated, but one thing at Family Health West we realize is that sometimes we don't always fix people, but we can always make someone's day a little bit better, whether it be a patient, a family member, a caregiver, a provider. Our goal is to always, no matter what, make somebody's day a little bit better. So why is this talk important? Well, part of it is because I'm a family doctor, I get tons and tons and tons of questions every year what is Medicare? What is Medicare Advantage? I need to pick one. How do I pick one? I don't really understand it. So this talk came from patients asking me over the years, what exactly is this? And I had tried to time it with open enrollment, because now is the time, if you have Medicare, to decide what plan is best for you. But I am going to talk a little bit, because if you're approaching Medicare, this talk is equally, if not more important for you, because you have to make some decisions from the very beginning. How do I take care of myself going into the future? So that's why this is important. So Medicare has an initial enrollment period. It starts 3 months before you turn 65. You have the month of your 65th birthday, and you have 3 months after your 65th birthday. So that's a 7-month open window to pick your or to sign up for Medicare. And I want to stress, if you do nothing else, sign up, because almost everything in Medicare has a penalty if you wait. So even if you're healthy and you don't need any medical care, you never see a doctor, and you actually don't ever want to see a doctor, you still need to sign up, because otherwise someday you might need to see a doctor, or something might happen to you and you don't want to be facing a penalty. And then there's the open enrollment period, and that occurs in about mid-October through December, and that this year is October 15th through December 7th. There are some reasons why you can extend that open enrollment period, but I'm not going into those today. But just kind of know that if you are over the age of 65, we are right in the middle of open enrollment. And so you'll have to make some selections and some choices before December 7th. Also, the reason why it's important is during open enrollment, you have the opportunity to switch between Medicare, Medigap plans, and Medicare Advantage plans. And we're going to talk about each of those and why you might pick one over the other here in a minute. But what's important to remember is during open enrollment is when you can switch. And during open enrollment, if you're 64 turning 65, it's guarantee issue. So you get to sign up without any penalty. And if you buy a Medicare Advantage plan, it's guarantee issue, so they have to sell it to you. There is, though, something important when you're thinking about going from Medicare Advantage back to a traditional Medicare plan. Depending on your medical history and some other factors, they actually can charge you for pre-existing conditions. And that's one of the things I find really, really interesting, because the Affordable Care Act eliminated pre-existing conditions for commercial insurance plans. But interestingly, Medicare Advantage is a commercial insurance plan, but they can still institute pre-existing conditions. So it's kind of interesting. And it's something I don't necessarily agree with, but it is important that if you're talking to an agent or broker, that may be one factor that you may want to consider, is what would be the penalty if I come back to one plan over another. So first, just some traditional definitions. So when I use the word traditional Medicare, or I say Medicare, I don't put the word Advantage after it, I'm talking about Medicare itself as it was originally designed. And there is Medicare Part A, there's Part D, there's actually Part C, but we call it Medicare Advantage. There's Part D, there's also something called Medigap plans, and there's also something called D-SNP plans, or dual eligible plans. We're going to talk about all of those today. But first, I want to talk about traditional Medicare, which is why you don't see C, because I'm going to address Medicare Part C separately. So what is Medicare Part A? Well, a lot of people call it hospital insurance. So that's one way to kind of think about Part A. It was passed in July of 1965, and it covers things like hospital stays. That kind of makes sense. But it also covers if you need Medicare approved skilled nursing facility rehab care, because Medicare does not pay for nursing home care. They do pay for skilled care in a nursing home for a limited number of days, if that makes sense. They also pay if you are on hospice, that's Medicare Part A. And if you need home health care, that's Medicare Part A. And at Family Health West, because we're a critical access hospital, we have something called swing beds or transitional care beds. those are paid for through Medicare Part A. So if you think therapy, so therapy in a nursing home, therapy at home health, therapy at Family Health West, that's Medicare Part A. Medicare Part A is free if you have paid Medicare taxes for at least 10 years, or your spouse has paid Medicare taxes for at least 10 years. In other words, joint filing. So you have to be joint filing that. It usually starts at age 65. Why do I say usually? Because some people with disabilities or other things can qualify for Medicare Part A before they turn 65. And if you don't enroll during your eligibility period, your premiums can increase up to 10% and a penalty may be applied. So what is Medicare Part B? Well, Medicare Part B is what some people call medical insurance. So Medicare A is hospital insurance. Medicare Part B is medical insurance. And the important thing is it covers medically necessary medical services. I always get a question as a family doctor, what is medically necessary? They don't care what your doctor thinks is medically necessary. And they don't care what you think is medically necessary. It's what Medicare thinks is medically necessary. But that's usually doctor visits is the most common thing that people think of with Part B, but it's also your Medicare, your medical supplies, and preventative care services. So under the Affordable Care Act, and through traditional Medicare, most preventative services are provided at no cost. Although this is a side note that I haven't given in my other 3 talks, I got a billing complaint yesterday from a patient as a CEO, not as the because they had their medical services for their preventative care coded based on a diagnosis, and so their insurance companies charging them a copay. Whereas if they're coded as preventative, they don't have a copay. So side note, not related to this talk, if you go to your doctor for a physical, make sure your doctor, if they're ordering labs, preventative care stuff, is coding it as preventative care because it does matter for your insurance company. What you might not know about Medicare Part B, though, is that this is what pays for your ambulance ride to the hospital. It's also what pays for the research. It pays for your CPAP machine or other durable medical equipment. It pays for your oxygen. It pays for some mental health substances. And interestingly, a lot of people know Medicare Part D pays for prescription drugs, but some drugs are covered under Medicare Part B. That is why when you go to your doctor, sometimes if you have Medicare, and you get a shot, the doctor will say, well, you have to get that shot at a pharmacy, or we can give that shot today to you here. It's not because it's not in the fridge. We have the shots in the fridge, I promise. It's because sometimes the shot is paid for under Medicare Part B, which means you can get it in your doctor's office. Sometimes it's only paid in Part D, so you have to go to a pharmacy. Sometimes it's paid both, like a flu shot, where you can get it at the pharmacy or at your doctor's office, and it's covered. Sound crazy? I think it's crazy. If you want to know why, talk to the lobbyists that lobby Medicare and your government, because a lot of those decisions about what's medically necessary coverage in Part B is based on evidence and literature, FDA approval, those kinds of things, but it's also a little bit political in nature on whether it falls in B or D.
No.
Why does that matter? Because you may want to consider what your Part D plan covers if it's not in Part B, those kinds of things. Medicare Part B is optional. You don't have to take it, but there is a late enrollment penalty, and the cost is at least $174.70 a month. That changes every year. And it may go up based on your modified adjusted gross income based on your tax return from the 2 years prior. And I want to say it's modified. That's important. It's not just your AGI, which is usually what your taxes are based on. It's a modified formula. So when I was researching for this talk, I decided that I was retiring at 63 to drive my income down so I could get a lower copay for it. I hope I can. I'm just kidding. But just know that your monthly premium really is determined based on your income in the years prior to your sign-up. And it does have a deductible. In 2024, the annual deductible was $240. So I'm skipping Part C. So what is Medicare Part D? I always think D stands for drugs. Medicare Part D was passed in 2006, so it's a relatively new program. And some people call it drug insurance or prescription drug insurance. And that covers most commonly prescribed drugs that you get at the pharmacy, but it also covers some vaccines not covered in Part B. Their insulin was recently capped at $35 a month. But what you might not know is that if you need food through a tube, we call that enteral nutrition, or you need food through an IV, that's usually covered under Part B. And then, of course, what most people think of with that too is if you, for some reason, medically necessarily need something like Boost or Insure or something like that, that would be covered out of Part D. In other words, if you use that stuff for a medical reason, you might want to make sure your Part D plan covers that stuff because that's where it would be covered. And if you need IVIG or intravenous immunoglobulins or something like that, anything that goes through an IV, if you get it at the pharmacy, it's generally Part D. If you get it at a hospital, it's generally Part B. Coverage is optional for this. There is a late enrollment penalty applies, and that can be up to 20%. And it compounds every year you don't pick a D plan. So say you're a Medicare patient and you want and you are completely healthy and you take 0 prescriptions, it's still important that you find a Part D plan because you don't want the penalty later when you do need a prescription. And we're all getting older, I promise. And you might need a prescription someday. So at least pick a free one. So a no premium one, so that you don't get the late penalties later. And then the cost varies by plan. The average when I was doing research for this presentation was $55.50 a month. But again, it can be as low as 0. One thing I'd always caution on a Part D plan is it's not what your premium is. It's what your premium is plus what you have to pay for your drugs. So it's the total cost out of your pocket a year, because you can get a more expensive Part D plan, but have no copay at the pharmacy, or you can get one that's 0, but have a big copay at the pharmacy. And sometimes it seems like it's free because you don't pay monthly, but your prescriptions can be really expensive at the pharmacy. Alternatively, you might pay more upfront monthly, but your prescriptions cost you next to nothing. You need to add those two together to know what your monthly cost is for your prescriptions, because sometimes they try to lure you with that 0 and then put some barriers in place when you actually need prescriptions. So Medigap, what is Medigap? So Medicare is subject to copays and deductibles. And so by law, you can actually buy insurance to cover those things and to cover things that aren't deemed medically necessary by Medicare. And those are generally called Medigap plans or Medicare supplement plans. So if you ever hear the word Medicare supplement, I have a Medicare supplement from insurance company XYZ. What you have is traditional Medicare with a supplement. Now, that it does your copays, it does your co-insurances, it does your deductibles. Interestingly, too, Medigap plans often cover care outside the United States, because remember, Medicare is a United States insurance plan. So you're generally not covered outside the US for your care. So if you're one of those people that spend half your year traveling outside the US, you may want traditional Medicare with a Medigap plan that covers international travel, if that makes sense. And we'll go into the other reasons why you might make a decision. Medigap can be combined with Part D. In fact, most people that have a supplement do a Medicare supplement with Part D, so they get their drugs and their copay coverage all in one monthly plan. The coverage is optional. It's guaranteed renewable as long as you pay your premium, so you can start and stop. But if you but your coverage is always possible if you don't start and stop. And then the plans vary by state. The cost varies by the plan. Again, it kind of depends on what your needs are. And then what are DSNP plans? Dual eligible plans is another name for it. DSNP plans are if you are eligible for Medicare and you are eligible for Medicaid, you can enroll in something called a dual eligible plan or supplemental plan. You can get different benefits, but basically what happens in a D-SNP plan is traditional Medicare pays first, and then Medicaid covers your deductibles, your co-pays, and those kinds of things. Sometimes Medicaid will cover things that Medicare won't cover as well. The one thing there is you have to qualify for Medicaid in order to have a D-SNP plan. And here, most of them are administered by Rocky Mountain Health Plans, but that doesn't have to be true. In fact, more and more of the Medicare Advantage plans are asking the state to have an eligible D-SNP plan, which would give people with Medicare and Medicaid more choices as to who they can use. And then because Medicaid is a state-run plan, then if you have a D-SNP plan, pretty much your coverage is in Colorado. If you travel outside of Colorado, that's okay, or traditional Medicare will still pay. But you may be subject to a copay or deductible because Colorado won't pay to cover that backside of the second. And then my helpful advice to you, if you are in a D-SNP plan or you do have Medicare and Medicaid, make sure you tell the hospital that, because if you show them your Medicaid card and they submit it to Medicaid first, your claim will be denied. If you just show them your Medicare card and you don't show them your Medicaid card, you may get a bill. So always just make sure that you hand them all of your insurance papers. The good news about D-SNP plans, because they're aimed at people that are qualified for Medicaid, they generally don't cost anything. And generally the coverage is very robust. There's very, very little financial harm or cost to a patient for enrollment or monthly premiums or co-pays and deductibles. So Medicare Advantage. Medicare Advantage actually began as Medicare Plus Choice. Some people called it Medicare Part C. It actually came during the Balanced Budget Act of 1997. And essentially what this is you sell your Medicare benefits to an insurance company. And then the insurance company administers your insurance for you. So how does that work? Well, the government has a few requirements. So first of all, how much they pay the insurance company is based on how sick you look. In other words, they try to make a calculation of how much you're going to cost. And then that's how much they pay to the insurance company. And the insurance company, on the other hand, then must offer coverage similar to Medicare in terms of benefits, but they can also do more if they want to. And they can keep the difference. So in other words, in theory, I'm not sure if it's true, but in theory, if they could provide you more and keep you healthier than the modeling that Medicare predicts, so they spend less, that's called profit. And so that might be a big reason why they might focus on preventative care, right? If they can prevent you from falling and breaking your hip, then they don't have to pay for a hip fracture repair. They can keep that money as profit. Does that kind of make sense? That's the theory of it. And we're going to go into a little bit of how that is put into practice or operationalized. The other thing with Medicare Part C is it can also be combined with a Part D plan. In fact, most Medicare Advantage plans do include a Part D plan if you want to, so that you can get it all in one package. And because they have to offer Medicare Plus, they can offer things that are not covered under traditional Medicare, such as vision and dental. And I will say that is a big reason why some people like the coverage, because Medicare doesn't pay for vision and dental. They can also entice. So in the healthcare industry, I am not allowed to entice you with free gifts, except for nominal stuff, but they can, and they do. So they will offer you food vouchers and gym memberships and cutting boards and holders and whatever that they want to entice you, they're allowed to do to try to get you to something. So what's the difference and how would you ever decide? Well, a lot of it is based on you and what your medical needs are. So under traditional Medicare, 97% of all doctors and hospitals in the United States take traditional Medicare, It crosses state lines, so you can go anywhere in the US and get your care, any medical provider. If you remember on Medicare Part C, how the government pays you a certain, or it pays the insurance company a certain flat fee for you, one of the ways that insurance companies save money is to try to negotiate with hospitals. I'm going to negotiate with my hospital, just like every other hospital. And if they can get a better rate at one hospital than another one, then they're going to prefer you go there. And that's called narrow networks. And so if you have a Medicare parts, or if you choose Medicare Advantage, you may only be allowed to go to network providers. They're going to restrict your choice. And because most of them are offered through commercial insurance companies, they're subject to state law. And so usually the Medicare Advantage plan is only good in the state they sell it. That's not always true. So you might be further restricted. So you may not be able to go to a doctor in another state. So if you say you wanted to go to the Mayo Clinic for an evaluation, you may not be able to because it may or may not be covered by your Medicare Advantage plan. Whereas with traditional Medicare, you can just go. Referrals. Again, we talked about Medicare says anything deemed medically necessary is covered. That's it. No prior authorization, no referrals needed. You don't have to do anything special. The reverse is also true. If it's not a medically necessary service, Medicare is not paying for it. They don't care how much you scream, cry, or produce evidence from your doctor that you need it. If it's not medically necessary, probably not covered. Medicare Advantage, they almost always want to try to get you into the doctors that they believe will give them the best value for their money. And so they may very well require a referral or a referral to see a specialist. Coverage, again, there's no dental, no vision, no hearing coverage under traditional Medicare. If that's something you feel like you need, traditional Medicare may not be right for you. Medicare Advantage, a lot of them do dental and vision insurance. Some people look at that as an enticement. Other people look at it as a very medically necessary thing that they need to make sure they have coverage for. And if that's you, a Medicare Advantage plan may be right for you. Network, we kind of already talked about that. The costs of traditional Medicare are very transparent. There's no surprises. The premium is decided at sign up. There is no deductibles. There is no co-insurance. That is not true of Medicare Advantage plans. And the best way that I can describe this is you sell your traditional Medicare to a commercial insurance provider. The commercial insurance provider is going to act like commercial insurance. So that's not necessarily a bad thing. I have commercial insurance. And I know that I'm going to have prior authorizations and things like that. So it's not necessarily a deterrent. I just want you to be aware that that's how commercial insurances make money, is by trying not to spend healthcare dollars on healthcare, because anything left over is called profit. And so they will, there's potentially surprise costs. And that also goes with approval and authorizations. If a hospital stay in my hospital is a deemed medically necessary by Medicare using Medicare criteria, it's covered. No approval needed. Medicare Advantage acts just like commercial insurance. So again, I'm not picking on them. I'm saying they all act like commercial insurance. They will do approvals and prior authorizations to put you in the hospital. They will make you get an authorization for physical therapy, and occupational therapy, speech therapy, a nursing home stay, home health, surgery, and they will even deny your ambulance ride. And let me give you an example. Let's say that you come to my hospital and you need transferred to community hospital. A lot of times Medicare Advantage plans will pay for your ambulance ride to my hospital, and they will deny the ride between my hospital and community hospital as not medically necessary. We work with Lower Valley Fire, which is our local ambulance service. We work with them almost every single day, fighting with Medicare Advantage plans and commercial insurers over paying for ambulance rides, because you couldn't exactly go by private car for your part. And we do get a lot of them paid, but they do require authorizations for things, even things like ambulance rides, durable medical equipment, lab tests, radiology studies. If you're below the age of 65 and you have commercial insurance right now, and you're like, yeah, to get an MRI, I got to go through all this rigmarole, and it takes a couple of weeks. They finally call me to get me scheduled. That's Medicare Advantage too. because the same insurance companies are administering both types of plans. And then, of course, they can do dental and vision care. Now, I want to talk a little bit more about surprise costs. I'm going to give you an example from my hospital. It is not uncommon for a patient to come into my hospital, and if they have traditional Medicare, covered. If you have Medicare Advantage, and you have the exact same disease, so by Medicare you'd be covered, they will disallow my hospital to put you in an inpatient status. They will force the hospital to put you in an observation status. Why? Observation is outpatient, which subjects you to a 20% copay. So by simply moving you from inpatient to outpatient, you now get to pay 20% of the bill. And they get to decide. And so under Medicare, you wouldn't have paid anything, and now suddenly you're subject to 20%. Now, do we fight that? Yes, we do fight that every day, and every hospital does. But it's just one of those things where that's what I call a potential surprise cost, because you didn't determine that. Medicare didn't determine that, and your doctor didn't determine that. That was determined by your insurance company. So I want to talk a little bit about how Medicare Advantage makes money. And so I'm not doing this to dissuade you from taking a Medicare Advantage plan. I just want you to understand how insurance works. And this goes for commercial insurance too, because if you understand how that works and then you're trying to decide a plan, you can then talk with your doctor about what your medical needs are and then find a plan that's covers you best. So that may be a Medicare Advantage plan, that may be traditional Medicare. And if you're in the room, you have Medicare, it's also how you decide what commercial insurance you buy if you get to decide. And I want with commercial insurance because they all make money the same way. So if you've ever been in business, there's two ways to make money, right? Revenue and expenses. It's really pretty simple math. Try to bring in more money, try to not send so much of it out, and what's left over is profit. So how does Medicare Advantage make money? Well, first of all, remember how I told you that the government makes a determination of how much you're worth per year, and that's how much money they pay the Medicare Advantage plan? Well, Medicare Advantage plans know that. And so they try to make you look as sick as hell. Because the sicker you look, the more money they get from Medicare. Now, it's funny, but it's true. They'll even send a nurse to your house to make you look as sick as you can without you accidentally running into a doctor for care, because care costs money. And so they call it a free nurse visit for a wellness exam. And if you're an optimist, you say, good, that's preventative care, that might save money. If you're a pessimist, you go, do they make people look sicker? And in fact, they do. In fact, there is a Medicare Advantage company that will send a nurse to your door. They will put a little device on your toe. And if it doesn't, and it's notoriously inaccurate, and it's not used by doctors to diagnose peripheral vascular disease, but insurance companies do it. And if you have that Medicare Advantage plan, you're 60 times more likely to have peripheral vascular disease than if you went to see your doctor. Why? Peripheral vascular disease has a really high hit. It makes you look really sick, right? Because vascular disease is a common killer. And so Medicare looks at that as expensive. And so they take advantage of that. The other thing is, and you may have seen this in the news because all the Medicare Advantage plans are howling right now. So if you follow healthcare news, you'll have heard this. But the government not only pays what you're worth, they also pay a premium or a bonus structure to Medicare Advantage plans based on their star rating. And so they want their star rating to be as high as it can possibly be. And so if you've been paying attention to the news, you'll know that Medicare actually downgraded the star rating of a lot of Medicare Advantage plans, and they are up in arms because it is costing them billions of dollars of potential profit. And so that's why they're howling. And what they're specifically howling about is that one of the ways that they do the star rating is called customer service. And so they call the customer service hotline for that Medicare Advantage plan, and they have a little checklist of things that they want them to say or offer. And if they don't do that, they get a lower rating. And there's specifically 2 Medicare Advantage plans in the news right now that are really complaining because they believe that they actually didn't get to a customer service representative. So again, I'm not picking on them, I'm just telling you what's in the news. But that's cost them a lot of money because that star rating is very, very important to how much revenue they can generate. And then, of course, the other way they generate revenue is to charge you for things, right? That's co-pays, premiums, things like that. How do they make money by making you pay a copay? Because every dollar they don't spend, they don't spend. So if you pay $100 for a test, they don't pay $100 for a test. That's $100 they get to keep. Does that make sense? Some people could say, well, that's expense management. Maybe it is. And so then they do expense management. So we already talked about how they contract with hospitals and doctors just like commercial insurance does. And so if they can get a better reimbursement rate from that hospital, then in turn, they can make a narrow network and force you to go see that hospital. And then they can pay less for your care, copays and deductibles, negotiated reimbursement rates, and then the ultimate profit generator, just don't pay for your care, right? So if they don't have to pay for your care, they make profit. And so they try to make it harder using things like prior authorization. So what is a prior authorization? It's not actually pertinent to providing you the treatment you need. So they may want, so for example, if you get an MRI, they may say that you need an X-ray first. As a doctor, I find that very annoying sometimes because most of the time they want an X-ray for something you can't see on an X-ray. And that's why I ordered the MRI in the first place. That may mean you still get an MRI. But think about it, one time that person gives up is an MRI they didn't have to spend. That's why they do it. And then denial of services. Again, every commercial insurance company does this. It's not picking on Medicare Advantage. They deny services proactively at the time of service. So I just got done telling you they denied inpatient status and patient observation status. They also do it retroactively. They'll allow inpatient status, they'll allow us to submit the claim and then deny the claim. And that's, if you've ever had that experience, you know what that's like. You had surgery, things like that. Prior authorization is not. So even though they've authorized you to have that knee surgery, they go ahead and deny it as not medically necessary. You say, well, I had a prior authorization. They say, well, that's not a guaranteed payment. And you go, well, why did I bother? Well, if you don't get the prior authorization, they're guaranteed you won't get paid. If you do get the prior authorization, you might. And it sounds like a game, and it kind of is. If you want to be optimistic about it, though, it really does make doctors and hospitals justify why you're getting the care you get, in the hopes that we have less medical waste. And we know there's lots of waste in the medical system. And so they're trying to prevent that. So again, I provide a balanced approach. Are you an optimist or a pessimist? I'm generally an optimist, so I know I sound like a pessimist. But that's that. So Medicare Advantage has been driving the profits of insurance companies for at least a decade, if not 2 decades. Profit is driving their care. That is why they want Medicare patients to sign up for their plans. So the Congressional Budget Office, so not me, I did a study in 2022. The Medicare Payment Advisory Committee says that the federal government pays Medicare Advantage plans an average of 4% more than if you were on traditional Medicare to cover a similar beneficiary. That's what I was talking about when I was saying they try to make you look sick. So you look similar to how you would have. They actually pay 4% more. Half of Medicare Advantage plan enrollees reside in counties where benchmarks exceed fee-for-service costs by 7.5% to 15% more. MA plan beneficiaries have higher estimated risk scores. Remember, looking sicker. MA plans payments are 3.6 higher due to tendency to record more health conditions. You will look sicker in your medical record than you feel if you're on Medicare Advantage plan because they get paid more. And traditional Medicare doesn't pay quality bonuses. I told you that star rating means bonuses. That's why it's so important to them. Well, quality bonuses don't pay for or aren't paid during traditional Medicare. So every dollar of that is considered extra, right? And so that's a cost that is factored in there. So here's Medicaid. about $753 per enrollee. This comes from the Kaiser Family Foundation. Commercial insurance, Medicare Advantage. You can see why insurance companies love Medicare Advantage, because look how much money they get in revenue per enrollee compared to individual. And I'm not advocating for this either, because I actually think they're less than cost of care. But you can see why there's a huge incentive to have you sign up for Medicare Advantage. And what happens when their star rating goes down or they have less profit? Well, profit decides their decision making. So all those perks, those cutting boards and potholders I told you about, they start to take them away. And in fact, there are two of them, I won't name them. They're actually getting rid of their perks to maintain their profits. Their profit is more important than their care. And these were all ripped out of headlines over the last, I don't know, I've been researching this for like 6 months. Every time I see something, I would throw it in a folder. And so I literally took this off of public headlines. And then my marketing team made it look this cool. The 1 hour nurse visit that lets insurers collect $15 billion. That's that home visit I was talking about, where a nurse comes to your house. That's worth $15 billion. So I'm not being negative. I'm not saying you shouldn't choose a Medicare Advantage plan. So how do you decide, do I do traditional Medicare, or how do I decide if I need a Medicare Advantage plan? So the first two big points I want to make is there is no single plan right for everyone. So I am not standing up here telling you you should have traditional Medicare, and I am not standing up here telling you you have to have a Medicare Advantage plan. And I'm definitely not saying it's Medicare Advantage Plan A or Medicare Advantage Plan B, because every single one has pluses and minuses. What's really important to me as a family doctor is that your plan covers your care. Because what breaks my heart is when people pick a plan that doesn't cover the medical care they need, and they didn't realize that when they signed up. So how do you know that? Please talk to your doctors. Please talk to your doctors. If you're getting cancer care here at a community hospital, please make sure that if you want to get cancer care next year at community hospital, the community hospital and their doctor is in your plan. Does that make sense? If you're going to get a knee replacement next year and you want to get your rehab at Family Health West, make sure Family Health West is in your plan. The other place I see that is with prescription medicines. Talk to your doctor about the medicines that you're taking and potentially medicines you might need in the following year, and have your doctor or your pharmacist rank them by most expensive to least expensive. I am not kidding when I've told you that people picked Part D plans to cover their $4 levothyroxine and they left their $300 diabetes medicines off the list. Please go after the most expensive ones first and make sure they're in your Part D or your Medicare Advantage with D type of plan. Make sure you know what that is. And I'm not picking on agents or brokers. I'm saying help agents and brokers by bringing that stuff to them and saying, I've talked with my doctor and these are the things I need to make sure are covered next year, and help them help you pick a plan that's right for your needs. Other things you might need to think about is travel. If you live half of your year in Arizona or Florida or New York, doesn't really matter, and you want traditional Medicare, great, you're covered. But if you're going to pick a Medicare Advantage plan, you need to make sure you have a Medicare Advantage plan that's accepted in both states. Because otherwise you're going to go to Arizona for the winter and suddenly you're out of network. That might be a reason why you want a traditional Medicare plan, or you want to pick a Medicare Advantage plan that's available across the state lines. And there are some there. Travel, international travel, we talked about that. International travel is not a Medicare benefit. Medicare Advantage plans almost certainly do not cover it, but you could certainly ask. Maybe there are some, but you can buy good Medigap supplemental coverage for travel. So if you're an international traveler, you may want traditional Medicare with a Medigap plan that covers international travel. And then limitations on networks. I already talked about that. If Community Hospital is your hospital or Family Health West is your hospital and your doctors are here, please make sure that the plan you pick has them in the first network. Because if you're tier 2, you pay higher deductibles, you pay higher copays. And then extras and perks. If vision and dental are really important for you, traditional Medicare doesn't pay for vision and dental. So you may want to consider supplemental coverage or a Medicare Advantage plan that includes it in their list of services. And then out-of-pocket caps. So one of the things that is scary about traditional Medicare is there is no out-of-pocket max. And that scare often drives people to think about Medicare Advantage plans. But we spent a lot of time talking today about Medicare Advantage plans and how they make money. They do have out-of-pocket maximums, $5,000, $7,000, $10,000, and they for sure want you to spend that first. So what I've often found is if you actually look at the care over the course of the year, people have been scared into Medicare Advantage plans so that they have a cap, but then they're spending that every single year. Whereas if they'd have been in traditional Medicare covered their hospital stay. So even though there's no cap, it's covered. So they actually paid less out of pocket. That's why it's really important, I think, to think about what medical care you're going to need next year and take that with you when you're making your decision of should I have traditional Medicare or should I have Medicare Advantage, those kinds of things, because you may end up needing that cap. And so you might want to choose a Medicare Advantage plan, or you might not want to pay that every year because you're pretty healthy and you want to sort of rely on the coverage, the broad coverage of Medicare. Barriers or limitations on treatments, we already kind of talked about that. Your specialists, things like that. If you want care out of state, like you said, if you want the Mayo Clinic or some other thing, like maybe you get your care there or something like that, you want to make sure they're in network. Even in Colorado, you have to be careful of the plans because like if you get your respiratory care at National Jewish Hospital, it may or may not be covered in your Medicare Advantage. So make sure it is before you pick. And then your personal health profile, planned surgeries, medical procedures, and expensive drugs. We kind of talked about that. So I want to talk a little bit about insurance agents and brokers. And I realize there might be one or two in the room. And this is not to disparage them. What this is to increase your knowledge of because I've talked to you a little bit about where insurance companies are coming from. Well, where are they coming from? Well, first of all, they are not medical experts. They cannot guess what medical needs you have next year. You have to tell them. So if you want them to help you pick a plan that's best for you, first of all, you need to know that. Second of all, so the second part of it is traditional Medicare doesn't need sold. Agents and brokers make zero leaving you on traditional Medicare. They only make money if they sell you a Medigap plan or a Medicare Advantage plan. And Medigap plans come with a commission. That's how they get paid. That's literally how they make money. And so do Medicare Advantage plans. So there is no incentive for them to leave you on Medicare, traditional Medicare, financially. I'm not saying they won't, I'm saying where the financial incentives are. So what does it take? Well, you have to be licensed in Colorado. Medicare agents generally represent one or two insurance companies. So the vernacular is an agent works for an insurance company. So you can imagine that, right? So if I only work for Family Health West and I sell Family Health West insurance, I'm probably giving the Family Health West insurance, right? That's generally an agent. Sometimes that's more than one company though. It's not universally true. And then brokers generally are independent and they usually offer a wide swath of different insurance plans. So the vernacular there is agents work for the insurance company, brokers work for the patient.
Yep.
I did have a broker.
So it's all electronic now. It takes us about 2 minutes to put it through. They'll send you a new card and we'll help you with the process of
Until January
first to use it. Yep. Yep. So you'll finish off with this. You'll keep this until December.
There goes him.
Okay.
I'll send, if we get it going, you know, between like I said, anywhere now from December. So let's say you.
Okay. It's okay. What's cool about that is I know there's at least one provider of this thing.
Can you repeat that about the agent versus broker?
So it's not universally true. I want to say that because someone's going to raise their hand and disagree. But in general, agents work for a single or maybe a couple of insurance companies. Brokers generally work for more than one insurance company. So brokers are more likely to give you a buffet of choices. An agent is probably selling one or two choices. Number two, they make their money through commission. Insurance companies generally pay a flat fee per sign up or a percentage of the premium for a commission. And Medicare actually sets maximums, and then Colorado gets to define their maximum. And every county in Colorado grants the maximum commission, which in 2025 is, or 2024, I think, is $611 for a new patient, $100 for a referral fee. So every time you come in, there's a $700 potential $700 incentive to put you on a Medicare Advantage plan.
Ooh, wow.
That's an enormous incentive when the alternative is zero. And to renew somebody on Medicare Advantage plan, the CMS and Colorado maximum for Mesa County is $306. So you can see, and I'm not saying don't sign up for a Medicare Advantage plan. I'm saying if you go to an agent, that is their incentive. So what can you do about it? Be armored with your medical needs, what you need out of an insurance plan, and make sure that you're kind of on the path of what's right for you. And you might say, well, Dr. Klein, I don't actually know the answers to that. So how do I get to that? And so there are some ways. One is to armor yourself with your medical needs. That's talking to your doctor, not just about your medical care now, but what you think you're going to need next year, or maybe in the coming years, what you need for specialists and specialty care, and your prescription drug list ordered from most expensive to least expensive. You can do that. And then there are places like Ship downtown that offer advice for free. They don't sell insurance. They're just advice. Ship. And I don't have them in a slide because I promised that I wouldn't. They're not selling anything. And they aren't selling anything either. They're just giving advice. So I don't mind giving out their name, but that's why they're not in my presentation. And there are other advisory organizations throughout the country. ARP can give Medicare advice. Be careful though, because a lot of people use ARP as a advertising scheme to get to a broker or agent. So be careful that you're not just talking to an agent. How do you know? Ask if who you're talking to is selling anything, and don't be afraid to ask. Those two things I said. How many insurance companies do you represent? And how do you get paid if I say yes to one or the other? Because if you know if they're getting $700 for one and $250 for another one, you might know what their advantage is. And I don't mean that in a bad or mean way. Used car salesmen do the same thing. Anything you can negotiate. I use cars because we often negotiate that. But anytime there's commission involved, it's okay to ask about what their commission is, including the used car guy. Like, do you get paid flat fee per car, or do you get paid as a percentage of the car? Because I know if you're getting paid as a percentage of the car, you're going to sell me the most expensive car you can. If you're getting paid a flat fee, they just want you to leave with a car. It doesn't matter which, right? That doesn't say you don't buy a car. It means you go in armored knowing what their incentives are. And also you can beware of people that only represent one of you, maybe selling one. And that's it. The rest of my talk is for question and answer. And I know there's some questions that can come from online, and we'll read those out loud. That way you all can hear the questions. And you can raise your hand. I really want this to be interactive. I've had all sorts of questions because, again, this is my fourth time. Thank you for coming. You told me you had to skip out a little early. And we'll just kind of end it there. So I'm going to start way in the back with an online question, and then I'll come up here.
Can the denial of service happen with Medigap plans? Medicare first decides it is not necessarily Medicare.
Yeah, generally the way Medigap plans work is Medicare pays first, and the Medigap doesn't pay. It's not designed to pay if Medicare doesn't. Most of them is designed to pay the copay or the deductible. So if Medicare denies the service, then so does the Medigap plan generally. So Medigap plans, now some exceptions to that is if you buy supplemental coverage for something specific not covered by Medicare, such as your foreign travel, I gave that example, but there's other things too, where Medicare may not deem it medically necessary, but you think you need it. You can shop for Medigap plans that would offer specific coverage. And that, in those cases, the supplement is the first payer. Medicare doesn't pay at all, right? Because it's a denied service.
Thank you. This has been very informative, and now thanks for letting us take pictures.
My name's Dave. I'm a retired dentist, and I've been on Medicare for years and Medicare Advantage. And I'm healthy. You know, I've had home health nurses call me after getting back from a 80-mile bike ride saying, have you had any falls lately? Can you get out of a chair okay? And now I'm kind of understanding why they do that. So
It's to keep you healthy.
Yeah. When you said pick a free D plan, is that from CMS or does that have to be through an insurance company? Where do we get Part D? And you said sign up for one, even if it's free one, should we do that even if we happen to be on an Advantage plan?
So the question is, how do I go about signing up for a D plan individually, and then what happens as part of the Medicare Advantage? So almost all Medicare Advantage plans combine Part D and Part C together. There are separate plans. So for example, some people get their medicines maybe through some other company or that kind of thing, or the reverse. You still have insurance through your old job, but you want some supplemental coverage through Part D. So sometimes you can buy them separate, but in general, C and D are sold together. So if you have a Part C plan, the question to ask is does it include Part D too, or do I need a separate plan? And then Part D plans are sold in the same way. You can sign up directly through Medicare, but generally they're sold through insurance companies. So most people use agents or brokers or Medicare type signups for that. And then the premium on a Part D plan varies based on plan. Some of them are free. And I always say you get what you pay for. That was the 100%. Yeah. The free one, you can generally get what you pay for. So Part D plans that have no premium generally have the highest copays for your prescription drugs. Generally the most expensive Part D plans have the most robust coverage of your prescription drugs. And that's why I said you really need to calculate what your cost of the drug is and your monthly premium, add them together to see what plan is right for you. So especially if you're on expensive drugs from the pharmacy, and the most common are diabetes drugs. They're incredibly expensive. The next most common are respiratory drugs. Who'd have thought that like the two highest killers in the nation have all the most expensive drugs? That kind of thing. But the point being is if you're on a respiratory medicine, you may want a more expensive monthly premium that has really good coverage of your prescription, because it might actually be cheaper at the end of the year than picking a free plan and then having to shoulder the burden of a lot of the cost of the drug. So that's why I say help your agent or broker by having that list. Talk to your pharmacist. Can you give me the cash price of all of these so that I can order them in most expensive to least expensive? In fact, they probably don't even have to look them up. They can go, this one's your most expensive, this is your least expensive, that kind of thing. So, and I saw that my mom was an accountant for a nursing home for 40 years, and she would sign up all of the people in her nursing home, and half the staff and like half the community would come and say, help me. You can go online and put your drugs in, find plans that cover them and stuff like that. But not a lot of people know how much their drugs cost. So if you put those in order, because she saw it all the time too, your thyroid pills are covered, but your diabetes medicines are covered. The other thing that you'll see, and I think you're actually hearing online that happens a lot in family medicine, is they'll cover a diabetes drug in the class, but not the one you're on. And so on January 1st, you have to switch. And that generally is okay if it's in the same class. But a couple problems happen. One is, what is the cost of the switch? Number two, maybe that one doesn't work as good for you. Maybe you've tried it already or something like that. And the worst thing is, the plan doesn't tell the doctor which one's on it. So they gotta give you a different prescription because you get denied by the pharmacy. And then I give you another one, you get denied by the pharmacy, and I give you the third one, and finally it takes it, and you're like, that doctor is crazy. It's not us, it's actually, the insurance plan doesn't tell us which one they prefer. And so we play a game of trial and error. And that kind of thing. So what I did with my own father, is he's on diabetes, medications. He gives me the list of covered drugs, and I go through and I circle the ones that are on his first tier, and he takes them to his doctor and he says, I've done my homework, doctor. These are the ones you have to pick from. That kind of thing, and it helps his doctor. I don't pick him for him. I am not his doctor. I am his care plan B advisor. Sometimes, but he does the same thing, right? Diabetes drugs first. The high blood pressure drugs are cheap. So if you have to pay cash, that's the one we don't want.
Would you say that, would you say that people with a lot of medical expenses should probably have the advantage plan?
I wouldn't say that's universally true. A lot of it depends on when you say expensive. All right, do you mean outpatient care like expensive cancer prevention drugs at the pharmacy? Do you mean expensive outpatient treatments like rheumatology infusions? Or do you mean expensive care like in hospital care like cancer care? Those kinds of things are paid differently by Medicare and in the different buckets. And so sometimes if it's an expensive treatment, but Medicare pays it at like 100%, you're better off with traditional Medicare than to have a copay or co-insurance through Medicare Advantage. Alternatively, if it's in Part B, there's not very well covered or something like that, or you're not sure, the cap can be sort of a safety net where you can say, well, at least I know my $5,000 out of pocket is the most I'll pay this year. That kind of thing. I'm willing to take that risk. That's why I think it's really important to talk to your primary care doctor or your specialist about your upcoming medical care. And you can ask questions like, am I going to need hospital care next year? Or am I going to need, is it more outpatient? What kinds of things am I going to need next year? That kind of thing, so that you can go and ask that. And you can ask that of the insurance company. My doctor says I need to get a knee replacement next year. I want to find a plan that covers me. What does traditional Medicare pay? Or what am I going to have to pay for a knee replacement with traditional Medicare? What would I have to pay with Plan A, B, C, and the Medicare person? And I know that that's difficult because even the agents and brokers have a hard time deciphering.
My husband and I's insurance, Medicare Advantage insurance went up $400 a month for next year. And so we're trying to decide, do we stay with that? Or do we, go back to traditional Medicare? The problem is that we have a lot of medical costs, heart disease, diabetes, just different surgeries and things. So,
Yeah, and I don't have a great answer for that, although maybe it might be worth talking to Ship.
right.
Somebody who's more agnostic, and they can walk you through the expected costs in both columns. And you can decide if that premium increase is worth it, or do you need to shop for a different one to try to get your premium more in line with your medical needs. And I'm going to go to the back and then I'll come back. I just wanted to relay one step. I should have just said, we're going to start in the front, work with Mike, way out to the back.
Talked a little bit about switching, but I've heard it is very difficult to switch, especially from Advantage to traditional. Is this true?
Yeah, so the question, if you didn't hear it, is I've heard it's difficult to switch back and forth, especially from an Advantage Medicare. And the answer is yes. Based on your medical conditions, you can be charged additional premium for a pre-existing condition to go from Medicare Advantage to traditional Medicare. I am not an expert at when that applies and if that applies to you, because it depends on your medical problem and things like that. That's where place like Ship can really help because they can try to answer those questions. And then if you decide it is too cumbersome to go from an Advantage to traditional Medicare, at least you have that knowledge and power, so then you can shop for the best Medicare Advantage plan. Because again, my talk is not designed to be agnostic for those. I want you to be in the right plan. is my goal. And
That was my question. So.
I've just got a quickie. Where is the video going to be posted?
so the video will be posted. The one that's being recorded today will be on the Community Hospital YouTube channel. I don't know exactly if you can answer that for me.
How many email address and I can send it to you after.
So if here, what we'll do is if you want a copy of it in your community hospital notebook, if you want to write your email address down, tear it out, and give it to us at the end, we'll make sure you get a copy. We're also recording it on Family Health West. We'll be putting probably a modified version. It's going to make you, leaner and Hunter's amazing. Give me hair. We'll be putting it on the Family Health website eventually too. I just don't know how long that will take.
All right, one more question, and that's it.
It goes back to what somebody in the back just asked, because I've been on this Medicare Advantage plan, sitting next to people who I don't really know their solar, but you're on Para plan. And I've had really no use for, any medical. And so I feel like I should just be on plain old Medicare and not have the premium that Para is taking out of my wife's insurance. She's a retired teacher, because that's gone up like 250%. We're on the higher deductible plan, so mine's going up from I think $58 to $170 some odd dollars for that. And when I'm on no medications, I get a gym membership, but I'm pretty sure I can swing that for under $170 a month. And who do we talk to? I mean, other than SHIP, can we find out from CMF what it would cost to go back to just conventional Medicare?
Can anyone in the audience answer that? Let me answer that question. If there is a resource there's lots of resources online. You have to be careful though. Some of them are actually marketing to you. But some of them that are marketing to you, as long as you understand that, they can still give you pretty good information. Just don't click spam me for the rest of my life on the buttons. But I think there's also some brokers that believe in traditional Medicare that sell more Medicare supplement plans instead of Medicare Advantage plans. And if you find one of those brokers, they could probably walk through the pluses and minuses and the penalties. But again, I'm not advertising an insurance agency, so I'm not going to say that. But I know there are some in our community that are more focused on the supplement type plans and traditional Medicare. And then there's some agencies and brokers that are more focused on the Advantage plans, that kind of thing. So,
Last week I talked to a SHIP guy briefly, and he was very concerned that we had lost our only 5-star Advantage plan locally. That sounds familiar. He said there was some that you could transfer into a 5-star program, and if you lose that.
yeah. So one of the games that insurance companies play with the star rating, I didn't tell you this, and I usually tell it. It's been a couple of weeks since I gave a talk. The insurance companies play a game with the star ratings too. I told you that they got downrated, but the other thing that they do is they take a small group of people, say 1,000 lives in Colorado, and they create this really robust, amazing Medicare Advantage plan. But there's only 1,000 people there, and they get a 5-star rating. And then the next year, you can transfer enrollees into your plan. And so what they do, and they do this a lot in Texas, not so much in Colorado, but is they do all the things they have to do for a 5-star plan with this tiny group of people, and then they transfer 1 million lives into it so that they can increase their bonuses, that kind of thing. And then eventually they get downrated and they do the same thing, that kind of thing. But the thing about star ratings are they are a marker of how well the plan performs based on a list of benchmarks set by Medicare. And some people think those are unfair. But that doesn't necessarily mean you're buying a better plan for you. And that's why I didn't spend a lot of time on star ratings, because I really think that your deductible, your monthly premium, your medical needs for next year are far more important than a star rating. So a plan that was 5-star last year that's 3.5 stars this year doesn't mean they're a worse insurance company because they didn't answer the customer service phone call or something like that. So I wouldn't rely on that. However, you're welcome. If you do want to shop for Medicare Advantage plan based on star rating, US News has a website thing called Medicare Compare. And you can go on there and you can put in your zip code. And the reason I'm using US News is because they're agnostic. They're not selling you Medicare or Medicare Advantage. It is Medicare Advantage though. They're not giving you traditional Medicare. You can go in there and you can do 81506 or 81507 or wherever you live. And it will give you all the Mesa County Medicare Advantage plans. And you can sort them by star ranking. You can sort them by whether they have a Part B plan with them. So if you want Medicare Advantage with a D, you can do that. If anything, that'll give you the list of who is out there in Mesa County. So you would know exactly who they are. And if the star rating does matter to you, you can sort them by that. And you can say, okay, here's the plans by star rating. The only thing I'd caution you is you still have to go back to, is the doctor in my hospital in the plan that I'm looking at? And it won't show you that. So if your specialists are here at community hospital, you need to make sure community hospitals in. The good news for Mesa County so far is generally our hospitals take most of the plans. That's why they sell them in Mesa County. But that is not always true. You can find plans that supposedly are in Mesa County that have no hospitals in Mesa County in their network. So ask the question. It's important. Sorry.
Maybe this too narrow for this group, but I'm a caregiver. My friends probably going to be Medicaid next year, and we're looking at the PACE program. Any thoughts about how that works?
Yeah, so the PACE program is not a topic for this discussion, but that is a Medicare-based program. So you definitely want more traditional Medicare if you're interested in PACE. Medicare Advantage may or may not pay for PACE. The other thing is if you feel like you're going to qualify for Medicaid next year, traditional Medicare with Medicaid, like a dual eligible DSNP program, is a better choice for that. And again, there's an enrollment period for that. So if you don't qualify for Medicaid till the middle of the year, you can then be allowed to sign up for the dual eligible programs. That's one of those that the open window has some modifications.
Yeah.
Sorry, I was going to try to answer though. You didn't raise your hand again. I just want to make sure you got recognized.
Is there anything on Colorado government website where you could go to identify plans that are offered within the state in terms of Advantage or supplemental or Medigap plans? And how do you contact SHIP?
I don't know the answer to the first question, whether there is a sort of a state-run website that shows everything offered. In commercial insurance, you can go for Connect for Health Colorado. Medicare, like I said, US News, if you go to their Medicare Compare, you can get the Medicare Advantage plans, but I don't think it shows supplemental plans. So I don't think there's a perfect one, but I also don't know the answer to that. So if somebody else knows the answer to that, but SHIP could probably do a pretty good job. And I don't have their contact information, but I can give it to you. Some people may know it.
That they're in the RSVP office, which is in the bottom of the US Bank building downtown. And you can sign up to meet with their people through the RSVP office.
The RSVP office at the bottom of US Bank downtown. And they probably have a phone number on the website, I'm sure. So you can make an appointment so you don't need to have dedicated time for it. Okay, I'm gonna go all the way to the back and then I'll try to come back up to the front.
That's two questions if you have time back. One is, if you're in this open enrollment period, people can change plans. If you want to change your Medicare Advantage plan, your traditional Medicare plan, does traditional Medicare have to accept you? And do the supplements have to accept you?
Yes, so the question is what about guarantee issue, which is have to accept you? And during open enrollment, it goes both ways. They do have guarantee issue. If you go from Medicare to Medicare Advantage, you just sign up for the premium that you're going to be offered. If you're going from Advantage to traditional Medicare, they can assess your monthly premium based on an illness score, so they can pre-existing condition you, which may increase your premium. But it is possible. It's just how much you pay per month that might vary. And so it's really important to ask that question before you make a decision.
Is that from Medicare or from Medicare supplement?
That's for Medicare. It's the monthly premium for Medicare. The Medicare supplement premiums, I don't know on the switching back and forth with that. I know it's guarantee issue, but I don't know if they're existing. That'd be a question for each of the
The other question is that I've read recently that some of the Medicare plans sold in Colorado are no longer available. So if we have a plan that let's say covers you for Arizona there and that plan is no longer available, what happens?
Yes, so generally in Colorado, per the Division of Insurance, if you're going to offer a plan, you have to make it good for the whole year. So anything available to sign up for 2025, they would have to guarantee coverage through 2025. So when people say, when commercial insurance says they're leaving the market, generally they give advance notice, like they're leaving the market in 2026. Or they won't sell a plan during the open enrollment period. So in general, the plans that are leaving Colorado in 2025 aren't available for purchase during open enrollment. So you'll see what is available, not what was available in years past. And usually if you're on one of those plans, you'll get a letter in the mail saying, you need to switch to one of our other amazing plans because we won't be offering this next year. Because most of those insurance companies, when they close out a plan, they still have other plans available, sometimes because they do the little switcheroo with the star rating thing. So the plan that's leaving Colorado might be a 2-star plan, and they're trying to push it into their 3.5 or 4-star plan because they make more money off of you in a better plan. And so that's part of the strategy that commercial insurance carriers do. So there will always be that. What's more scary is if they leave the market entirely. And what's interesting about Mesa County is in most markets where Medicare Advantage has a very mature market, and we're going to go way off the rails here for a little bit. But for a long time, Rocky Mountain Health Plans had a Medicare cost report based Medicare plan. And because of that, Medicare Advantage wasn't allowed to be sold in Mesa County. And so Medicare cost report based plans were getting so obscure that Rocky Mountain Health Plans was going to Washington to educate Washington on what they were, because no one there had any more institutional knowledge. And so it was getting harder and harder to administer the plan in terms of audit risk and funding from the government. And so when Rocky Mountain Health Plans was purchased by United Healthcare, there was a decision made to let that cost report based Medicare plan go. And as a result, that allowed Medicare Advantage to enter our market. Most mature markets, you get 2 or 3 choices and that's it. It's whatever commercial insurance decides that there's a profit in, and then that's the end of it. Because we don't have a mature market because of that, you literally can get pages and pages. That US News thing, I think there's 5 pages of plans, different plans from different carriers. It's an enormous list. I mean, I think my hospital takes something like 9 different Medicare plans. It's an enormous list. That's why partly the education to make sure your doctors are in the network. Some of those things offered don't actually have our hospital, our local hospitals in them, or our local hospitals may not always be in these plans as they maneuver. Because again, remember, they're trying to build profit. And so they're constantly changing their plans to try to figure out what that combination is. So that's incumbent on you to say, wait a second, I want to make sure my local hospital is in my plan.
They can call it.
Okay, I have the phone number for RSVP class that if you would like it, pens ready. Lost it. I scrolled too far. All right, so that phone number is gonna be 970-243-9839. So 970-243-9839.
Next year, I'm going to be sponsored by shit. I make no money off this stuff. Community hospital did not pay me. This is community outreach. I'm just kidding.
You keep talking SHIP. I'm not familiar with that term. Is that an acronym for something? SHIP, or is that strictly advisory?
It's not actually, I'm looking at their website right now, so it's considered RSVP, and they are with AmeriCorps for seniors. So they provide,
It probably stands for something.
it does, but it,
Health insurance.
Health Insurance Assistant Program.
There you go. See, that's why I have an audience, because you guys can help answer it. do a couple more if you guys are still willing to do question and answer. So
Go ahead.
I'm,
I just have a question about the out-of-pocket caps. You mentioned the Medicare out-of-pocket, and I know all the Advantage plans have a cap that maybe readdress what's the Medicare cap.
so there is no Medicare cap. So that's a scary thing that often drives people to Medicare Advantage. But again, you have to consider, it may not have a cap, but it has pretty low copays. So for example, inpatient care, you may not have a copay at all, or you may have to hit your deductible, which is $240, and then you're good. That kind of thing. So there's no cap, but the coverage is very robust. On the other side, there is a cap, but they intentionally make their coverage less robust because they're trying to so again, it's a hard decision. So I totally understand why people pick a Medicare plan for that peace of mind of that out-of-pocket cap. But I also totally know that insurance companies ensure that they try to hit that every time, because if they can have you pay another $5,000 for your care to Medicare, in addition to what Medicare paid, that's an enormous amount of money for them to pay for a care that they would have paid for anyway or otherwise. So it's a hard decision on that. And I'm not advocating for one or the other, because it depends on your personal medical needs. Back there, and then we'll come up.
So the Medicare Advantage plan that I have, if I need a surgery, if I need an MRI, they're approved almost immediately. They don't argue with my doctor over anything. And you're saying I don't need approvals, but it would be, they have to think it's medically necessary, Medicare. Do you find it's harder?
I can't speak for every single procedure, but I can tell you, let's pick MRI, for example. MRIs are generally paid for by Medicare within 15 days. MRIs with Medicare Advantage, generally it takes 3 or 4 or 5 days to get the approval. And then you get the prior authorization. And for things like MRI, pretty easy. I would say that they're mostly approved in healthcare. And then it takes about 100 days to get paid by Medicare Advantage. Because every day in the stock market, they finally pay you. I'm being cynical, but I'm glad you picked a plan that's not hassling you too much. Yeah. And I will say, for doctor's visits, vaccines, x-rays, labs, most Medicare Advantage plans, you won't see much hassle. That pretty routine stuff is pretty routine. It's when it gets more complex, like cancer care, heart disease, things that start to cost them a lot, they start to get pickier and pickier and pickier. So if you have a rheumatology disease and you're on an expensive drug, suddenly they'll have their insurance company. It's a lot more interesting to work with, things like that. The best advice I can give you for that, though, is work with your doctor and work with your hospital to get your bill paid, because your insurance company wants you. They don't care about the hospital, they want you. So if you advocate for your bill, it's more likely to be paid. So if you were to get hassled for your prior authorization for an MRI, you calling your insurance company saying, I need my MRI, is a much more effective tool than a prior authorization person at my hospital. So if you are in the situation where you feel like your insurance company is just in the way, work with your hospital to try to advocate for your care. And that's a really effective method. I want to go front here, and then I'll go back to the online group.
So about 2 years ago, I switched from traditional Medicare to Advantage. And your Part B goes to the insurance company, that money.
Yes.
So you are no longer charged the $174.70.
No.
That's pretty interesting, because I've been charged that amount. So it still comes out.
B still comes out.
Yep. Yeah.
Okay.
Just, yeah.
So B still comes out even if you're on a Medicare Advantage plan. I'm hearing yes.
I was just curious on
So you're not alone.
Okay. So what does that mean?
I don't know what that means. That's an interesting question.
One more part to that, not to that, but so I'm considering going back to traditional. And then what keeps coming up today is beware of your pre-existing conditions. How extensive are pre-existing conditions, such as
in the last year or so, I've been diagnosed with more osteoporosis, and I'm going to start taking medications for that. Is that a pre-existing condition if I switch back to traditional?
That's a good question on the pre-existing conditions. I had a broker at the last month that said that it's not very robust. It's just a few things that are really important. So I think that's just a question you'd have to ask. I would guess osteoporosis probably not that big of a deal, pretty common. That kind of thing. I think it'd probably be more expensive diseases like transplants or disease.
Sure. Okay.
Things like that. But I'm not an expert on what that list looks like or what that cost would be.
Okay. Is it easier to find a new doctor or to switch doctors with one or the other, traditional or advantage?
That's a great question on picking doctors. Almost again, 97% of all doctors in the US accept traditional Medicare. So picking a doctor on traditional Medicare is super easy, especially if you're planning on moving to a new community. Traditional Medicare may be right for you because you know your access is going to be the broadest you can get, because maybe practices are full or maybe you only have a few choices, that kind of thing. Medicare Advantage intentionally tries to select doctors who will accept the best reimbursement or most favorable reimbursement for them. And so you're going to have the most restrictive network on a Medicare Advantage plan. And I will say in some communities, ours is a notorious one, but there are other communities finding a primary care doctor can be very hard to do. And so if you couple that layer on top of that, a very restrictive Medicare Advantage network, you may have extreme difficulty finding a doctor that not only takes your insurance, but has an opening for you. That kind of thing. There are some Medicare Advantage plans that even hire their own primary care doctor group. And so you may have to actually see one of their employed primary care doctors in some markets. That's not true in our market, but there are some markets in the US where if you pick Medicare Advantage XYZ, you have to go to the XYZ clinic. And they're very good at diagnosing you with illness. Because their doctors are financially incentivized the same way that the nurse at the home nurses. I know that sounds cynical, but it's all right.
I recall hearing over the last couple of years that some of the big insurance companies that offer Advantage plans are giving millions of dollars in bonuses to their employees. Do you know anything about that? Do you recall hearing?
The question was do Medicare Advantage plans, insurance companies give bonuses to their employees, and they absolutely do. I would say they behave like a business. So they probably incentivize their employees in a variety of ways through wages, bonuses, perks, things like that. They also incentivize the brokers and agents through commissions and things like that. There are maximums though of what they can pay by law to a broker, but there's no maximum of what they can pay their own employees and things like that. And really, a lot of these companies are traded on the stock market and share price, making sure that their profit is at the right level. As long as they get to that, then the shareholders generally don't care what the bonuses are. So you can find that stuff in the news. You can find share prices, stuff like that. But then I showed you that one slide that showed how they're actually slashing your benefits or Medicare Advantage benefits in order to maintain their profits. Notice they weren't slashing the employee bonuses, or they may have, and they just didn't. That didn't make the news. I'm not trying to pick on them. I'm just saying, but they're behaving normally. They're commercial insurance companies. They do that in the commercial market too. They're not behaving any differently or special or separately because it's Medicare, except for 40 to 60% of their profit is now coming from Medicare Advantage. So they absolutely care about it a lot. Any other questions? Those are the most questions I fielded. So thank you all for coming again. Thank you, Community Hospital, for having me. And if you want more information, if you want the YouTube version of this, jot down your email address and let Brooke have it in the back. Thank you all. Yep.
This is